Video-based supervision for training of endoscopic submucosal dissection. Introduction. Endoscopic submucosal dissection, ESD, is an advanced endoscopic technique that allows for en bloc resection of early cancerous lesions from the gastrointestinal tract, regardless of the lesion size or associated fibrosis. The advantage of ESD over endoscopic mucosal resection is the higher en bloc resection rate, which allows for more accurate histopathologic analysis, higher R0 resection rates, and lower recurrence rates. Compared with surgery, ESD is less invasive. Despite these advantages, to date ESD has been poorly adopted in Western countries. This has in part been secondary to the flat, difficult learning curve of ESD. ESD was developed more than a decade ago and has now become the standard of care in Japan and other Asian countries, Korea and China, for the treatment of early cancerous lesions throughout the gastrointestinal tract. In Japan, ESD is taught in a hands-on fashion using the traditional mentor-apprentice approach similar to that which is applied to endoscopic retrograde cholangiopancreatography, ERCP, training in the West. Japanese trainees initially gain competency in gastric ESD cases that are safer and easier to perform before attempting more technically challenging lesions in the esophagus and colon. While the hands-on mentor-apprentice approach has worked well in Japan, it is currently not a feasible approach in the West, as there are only a few highly qualified Western ESD experts. In addition, because early gastric cancer is rare in the West, Western endoscopists have to begin ESD in the more technically challenging locations of the esophagus and colon. Therefore, many authors have suggested ESD training in a porcine model before embarking on procedures in human cases. The porcine model is a commonly used method for ESD training. However, ESD involves many maneuvers that are not commonly used in traditional endoscopy. As such, guidance is needed in order to learn the intricacies of the ESD technique. Supervision by ESD experts through a remote video-based system may be a practical method of achieving this guidance. The aim of the study was to assess the value of video-based remote evaluation in supervising ESD training. To address this aim, Bhatt et al. Analyzed the learning curves of 2 Western endoscopists performing ESD training in a porcine model, as assessed and supervised by a Japanese ESD expert through a remote video-based system. Background and study aims. Adoption of endoscopic submucosal dissection, ESD, in Western countries has been limited by the difficulty in learning the procedure. Although a porcine model is commonly used for ESD training, without expert guidance the procedure is difficult to master. The availability of Western ESD experts is limited, and expert supervision through a remote video-based system may be a practical method for Western endoscopists to learn ESD. The aim of this study was to assess the value of video-based remote evaluation in supervising ESD training. Methods. 2 Western endoscopists performed ESD training procedures in an ex vivo porcine model at least every 2 weeks until competency was achieved. Competency was defined as consistent en bloc resection of a 3 cm area within 30 minutes and without perforation using the proper ESD technique. A Japanese ESD expert at the National Cancer Center in Tokyo, Japan, analyzed the training videos, scored them, and provided written feedback for improvement after each training session and before the trainee's next training session. Results. Endoscopist 1 reached competency at 23 procedures, and endoscopist 2 reached competency at 25 procedures. No difference in skill improvement between the 2 endoscopists was noted. 1 trainee subsequently completed 8 ESD procedures in patients with curative en bloc resection and no complications. Conclusion. A standardized ESD training program including educational presentations and videos and preclinical animal training with expert guidance through a remote video-based system is an effective tool for learning ESD techniques in preparation for performing the procedure in humans.